Here at East Boston Neighborhood Health Center, we are proud to care for a wide variety of patients each day. No patient is the same, and we do our best to create a comfortable and safe environment for each person that walks through our doors. Today, we'll be talking about how we can create an autism-friendly practice for our patients who have autism spectrum disorder. Autism spectrum disorder, or ASD, refers to a range of conditions that are characterized by challenges with social skills, repetitive behaviors, speech, and nonverbal communication. The abilities of a person with autism can vary drastically, thus it being a spectrum disorder. We as healthcare professionals should understand that not every person with ASD will interact with you or their environment the same. We will be discussing some interventions that staff can add to their toolkit to help people with autism feel more comfortable and have a successful health visit. Though each person with ASD is highly individualized, there are some common events that can lead to escalation. It is our job in the clinic to recognize these events and de-escalate to the best of our ability. The top 3 events that lead to escalation in primary care include prolonged wait times, hyperstimulation from alarms and bright lights, noise or unexpected touch, and many unfamiliar people, unfamiliar spaces, and unfamiliar experiences. Signs of escalation can include, but are not limited to, avoidance, unfocused behavior, sudden, repetitive movements, screaming, or pacing. Though some of these events are unavoidable for us, we can recognize them and employ proper de-escalation techniques to help our patients feel comfortable going through our clinic. A child is less likely to escalate when they are comfortable with the environment and people around them, and we as staff can help facilitate that feeling of comfort. The first method of de-escalation is a technique called mirror and match. This staff member is matching the child's height by squatting down so the child does not feel threatened. The staff member is softening their facial expression and loosening their hands. This gives the child a chance to match the staff member's relaxed body posture. The staff member is not standing toe-to-toe with the child, which may feel threatening and like a breach of personal space that the patient may want and need. Make note that the staff member should be more than an arm's reach distance from the patient. The staff member is mirroring the child's emotions, empathizing with the child's feelings to make sure that the child feels understood. When empathizing with a person who may be having a behavioral escalation, it is important not to tell the child to calm down. We want to make sure that the child feels heard, understood, and respected. People with ASD understand concrete concepts and sentences. Saying, "I know the sounds in here are overwhelming," is not only acknowledging the trigger, but it is also using concrete language to identify and place what may be triggering and causing the behavioral escalation. One of the most common triggers in the primary care setting includes overstimulation, including bright lights, transitions, and unfamiliar places or people. While transitions and unfamiliar people may not always be avoidable, the staff at East Boston Neighborhood Health Center are able to control some of the triggers. For example, something as simple as being able to turn off or dim the lights. Therefore, the second method of behavioral de-escalation is turning off or down the lights to avoid this overstimulation. This is incredibly helpful if the patient is actively escalating while in the clinic room or private waiting area. Allowing the time for de-escalation is critical for the patient to start feeling comfortable again. During this time, it is crucial to remove any overstimulating triggers, not to introduce any more. Bringing in more people or staff can lead to a greater escalation and stress. By turning off the lights and alarms and limiting the amount of people who are entering the room, de-escalation will be more effective. The last behavioral de-escalation technique that we'll be talking about today is the use of what we call an alternate option. This will allow the child with autism to focus on a stimulus-reducing toy rather than the potentially triggering environment around them. By involving the child's parents or guardians, the staff can find an adequate item that the patient might feel comfortable using. This can include a blanket, a sensory toy, crayons or markers, or anything that the parent might suggest. We have some toys that we use here in our clinic, such as pop tubes, balls, bubbles, crayons, and stickers. It is important that the staff member is the one who is facilitating the behavioral de-escalation. Most children are responsive to adult direction during escalation, and making demands of the child can cause increased frustration and stress, thereby leading to additional escalation in behaviors that are commonly associated with autism. By offering the child a stuffed animal with a simple yes or no question, we are allowing the child a comfortable option while also remaining empathetic. Children with autism spectrum disorder generally respond better with first-then statements. By providing the child with a stimulus-reducing toy, then explaining with a first-then statement, de-escalation will be smoother and more effective. East Boston Neighborhood Health Center is proud to have the CATCH program and care for the variety of patients that we see on a daily basis. Using a team-based approach, collaborating with families and fellow staff members, we can create a comfortable and safe environment in our clinic for anybody who walks through our doors. These de-escalation techniques are one way that we, as staff, can facilitate this comfortable environment. We now ask that you proceed to take our post-educational survey provided to your email. Thank you for your time and your effort in creating an autism-friendly practice.